Go ahead, ma'am.
Hi, everybody. Good afternoon, and welcome to today's FB live session. Today's session is about how to remain positive in your fertility treatment, and this is a very, very important aspect. Often it is overlooked, but today we're going to discuss it. Let me just start by recapping how our fertility journey proceeds. If you're somebody who is coming for preconceptional counseling, that's great. We are going to lay all the investigations out, the basic ones that are needed, and we're going to map what issues come up in your fertility journey. If you're somebody who's already married and who has been trying for a year or so, we're going to start with again simple investigations and simple steps of fertility treatment, which is like ovulation monitoring and timed intercourse. If you have somebody who's already done that step, then we are going to check for your tubal patency, and the next step is IUI or intrauterine insemination. This is again a moderate procedure, moderate complexity procedure. We are trying to grow your eggs and then take your husband's semen sample, wash it, and then put those sperms inside your uterus. And the last step for any person's fertility journey is IVF or ICSI. In this, we are trying to grow your eggs. We are trying to take the eggs out of your ovaries in the procedure called as ovum pickup. Then we are trying to take a sperm and put it inside your egg and make embryos outside in our lab. So this is why the common language term of test tube baby has come into being. And once embryos are made, in the next step, in the next cycle, we are going to transfer the embryos back. So this is IVF procedure. So fairly simple, three steps. First is ovulation monitoring. Second is IUI, and the third is IVF. So overall, your fertility journey will comprise of these three steps. Now, we see many times patients who have come, they have been trying for many years, they've been struggling with issues of infertility, and by the time they come to us, they come in a very I wouldn't call it hopeless, but a very sort of depressed mental state. They come to us, they have had a lot of previous struggles, a lot of previous cycles have failed, and they come to us in a mental state that is very depressed and struggling. So we see a lot of spectrum of patients in fertility, people who are hopeful, people who have just started trying their cycle, to people who have really tried a lot and then come to us said that we've tried so many things and doctor, nothing has worked for us. So there's a whole wide spectrum of patients who come to us for fertility treatment. There's a whole wide mental scape that comes to us when it comes to fertility treatment as well. Today, what I'm trying to talk to you about is how to maintain a positive mindset during your fertility struggles. So, I understand at the very basic that fertility should ideally come as a natural thing in a human body or in a woman's body. But when you cannot conceive, that by itself is a major setback mentally, and we see so many patients struggling from this. So many times, your mental issues can seep in through and form couples issues. So there might be a lot of divide happening between the husband and wife just because of these things. Sometimes the male partner is the one who is depressed, sometimes the male partner is struggling with male infertility. So again, a lot of spectrum where we see a lot of issues. So some of the steps to counter this is, first, allow yourself to feel the emotions. Some of the patients are in complete denial of their mental struggle that goes on, so let's not do this. Allow yourself, if you're somebody who is feeling negative about your fertility, if you're somebody who is struggling mentally when you're on your fertility, talk to your doctor, talk to people around you, allow yourself to feel those emotions. They're not bad emotions. It's something that has to pass through your body. It's something you have to really own up that, yes, I'm facing these issues physically. Secondly, I'm facing these issues mentally as well. There are outlets available today. You can take counseling for these issues for your mental health. Only if you're able to have a good headspace will your physical body also sort of fall in line. There's a lot of connect between mind and body. There's a lot of things that you think and they manifest in your body. So really, if you are facing mental issues, it's something that you should tackle head on rather than be in denial. So allowing yourself to feel these emotions is the first step to freedom from them. Second most important tip when you have fertility issues with along with mental issues is talk to somebody you trust. If you have an inner circle of people who you can really open up and talk that, look, I am facing this, I am going through this, and you have that sort of a listening ear, that will give you a lot of strength. You have somebody to bank on. Now if this is your partner, fair and good, you can openly discuss with your partner, but you can also talk it out with your close circle of friends, your close knit colleagues at work. Suppose if you can open up and tell them, this can really elevate your mental issues, and it really helps you, because these people you trust also come up with solutions for you. They also come up with things, they say things that give you more confidence, they say things that invigorate you to keep on this track, to have your fertility goals on site. So it's really something very beautiful when you talk to somebody you trust, and they help you, like a judgment free ear they give you, and you can really clear your headspace when you talk to people like that. So that's the second tip: talk to somebody you trust. The third tip is, when you are facing any fertility issues or you're on any fertility treatment, prioritize yourself. You can get caught up with social engagements, you can get caught up with work, you can get caught up with your ambitions, you can, and all of that is fine. But your body needs rest when you are taking fertility treatments. Your mind rate needs rest. You need to hear your own thoughts when you're on fertility treatment, and that won't happen if you're overworked, your time is spent just busy being busy. So prioritize yourself. Now prioritize yourself physically, so that you're eating nutritious food. Prioritize your exercise routine so that you are in your best physical form to conceive. Also exercise lets on a lot of endorphins in your system. So immediately you sort of get pump, you have these good hormones pumping through your system. So that is one thing that you should really try and look forward to. If you can incorporate a variety of different exercises in your routine, that usually works the best. Getting good sleep, very very important for your mental health well-being. Around 7 to 8 hours of sleep if you're getting, your body is really recovering from all the trauma, right? Your body is recovering from the work that you've been doing, your fertility treatments, the stress that you're carrying in your body, everything you can let go while you're sleeping. So getting a good sleep, really important for your mental well-being. So prioritize yourself on all these things. Don't waste your time doing unnecessary things. Don't try and be a little bit more selfish in your life and focus on yourself. So that is tip number 3 for your mental well-being. Tip number 4 is journal your journey. So many times we see writing down really helps patients. So writing down what you're going through, making a note of it at the end of the day. How was your day? What did you do in the day? Did you have a doctor consultations? What sort of notes have your doctor given to you? Is there any further appointments that you need to jot down? Has somebody made you feel a certain way? Did you have a fight with your partner? How is your fertility journey going? Is there any progress? Is there any success? As such, writing down these things will really help empty your mind out of it. You can also write fertility affirmations. You can also write, what are you hopeful for? What do you hope to achieve at the end of this fertility journey? What are your dreams? What are your goals? What are your family goals? How many children do you want? So writing down all this, and if you can include your partner in this, it gets even more beautiful. So this is the fourth tip that I can give you about good maintaining a good mental health. So really important one: allow yourself to feel all the emotions. Don't deny anything you're going through. Secondly, talk to somebody you trust. Really helps elevate all your issues. Third, prioritize yourself on a mental well-being note as well as a physical well-being note. And fourth, journal your journey. Write down the things that are important to you, that make you feel good, and you will feel good. The fifth and the most important thing is, whenever you are on a fertility journey, things can get stressful, and talking to a mental health consultant will really help you go a long way. Take a counselor on board if possible. Go and take sessions at least once or twice a week. Empty out your heart, empty out your mind with the consultant. Take feedback from that person as to what can make your journey better, right? Your quality of life can really go well during your fertility treatment, and in the long term as well, if you can sort out issues in your head, right? Issues with yourself, issues with your partner, issues with your marriage, issues with your in-laws, whatever may it be, issues with your fertility, whatever it is, if you get a consultant on board, if you can get a counselor or a psychiatrist on board, it is going to make your journey that much lot smoother. So do invest that much money and do invest that much time in getting these things done, and that will go a long way to give you a positive mindset in fertility. And trust me, it makes a lot of impact. Your hormones depend on your mental state, right? So if you're stressed, overly stressed, not only are you not allowing your hormones to do their job, you are actually prolonging your fertility issues. You're also prolonging your lifestyle disorders that may affect you due to the chronic stress. So it's a priority whenever you are on fertility treatments to get your mental health sorted. And a positive mental health will go a long way to keep you healthy and prosperous. That's it for today for how you can maintain a positive mental health journey on your fertility treatment. We would love to take questions if you have any based on this topic. You can also directly call our helpline numbers listed over here for any queries regarding your mental health with your fertility or regarding any fertility issues at all. Our centers are in Wakad as well as Kharadi in Pune. So you can come down directly or just take an appointment calling this helpline number as well. So if there are any more questions, yeah. Does IVF change your mood? Okay, so what is IVF? Basically, we are giving you hormones to grow your eggs. Now, there can be temporary mood effects because how during your fertility cycle you do have a change in mood because of your changing hormones. Same effect IVF injections will have. So you may have some mood swings, you may have some irritability, you may have a little bit of breast tenderness, you may have a little bit of dragging pelvic pain, like cramp like sensation. Usually these mood swings will go off as soon as these hormones are washed out of your system post your IVF cycle. So no long lasting side effects are seen, but temporary changes in mood can be seen during an IVF cycle. Is IVF stressful on the body? So IVF involves a lot of investment when as it comes to your time that is involved, the money, of course, that is involved, and physically you are involved in the process. Unfortunately, the brunt of IVF is taken on by a woman rather than by a man. Because we all know women is the one who is going to carry the child, so the entire IVF cycle is also done on the women's body. So there's a lot of injections that you have to take. You got to bear with that. There's a lot of ultrasonographies that you have to take. You got to bear with that. There is ovum pickup procedure which is done under anesthesia, but it's a small operative procedure, so we got to do that. And then the embryo transfer. So yes, the answer overall is not acutely stressful, but yeah, over a long time, over a period of couple of months, it does take a little bit of stress and a toll on your physical body as well as your mental mindset. So we do need to do have some active sort of involvement to keep the stress off the bay. So a little bit stressful, yes. Are there any mental side effects of fertility treatments? I wouldn't call it mental side effects. A little bit of mood swings, a little bit of irritability would come in the picture, but nothing that would require any psychiatric interventions or anything like that. So I wouldn't call it a mental side effect as such, but yes, as it happens during your periods, a little bit of irritability, change in moods may affect you. Of course, it does not affect all the women. Not all the patients that have IVF treatments come and tell us that, we are getting really irritable or we are really having this sort of treatment symptoms. But some set of patients do come and say that, I am a little irritable and I am feeling a little bit of pain in the abdomen. So they are quite minimal. It's nothing big. So yeah. Do fertility affirmations work? Fertility affirmations work beautifully. They'll go a long way to help you on your journey. I would suggest everybody use this. Whoever is trying to conceive, even if you have no problems conceiving, if you're just somebody who is trying to conceive, stand in front of the mirror early morning, when the sun is shining, and tell yourself that I'm going to conceive beautifully. My body is something that is going to help me conceive. I'm going to I can carry a child beautifully in my body. My body has the ability to nourish an entire human being inside. And do give it a try, and then tell me if fertility affirmations work, because I've seen it work beautifully in patients, and not only do they not work, but it your entire journey is also going to be really soothing and a really happy sort of feel to it. So overall, the answer would be yes to that. Right. So that's it for today. And do give us a call on the helpline number for any further queries. Thank you so much for logging in.